All right, Bismillahirrahmanirrahim. So I'll start the session for tonight. Welcome back everyone to the ANSARA Muda Career Talk series. So as everyone has known, it is a program organized by the collaboration of between the ANSARA Shongan Taiping and also our counseling unit from MRC Taiping. So our objective is for the students to explore and get to know more on the various career fields and industries from our respective speakers lah. So as of that, for today, we have Dr. Aliya with us, a specialist registrar in endocrinology. I'm so afraid that I might mispronounce that. Diabetes and internal medicine at Swansea Bay University Health Board, Wales, one of the local health board in Wales. So yeah, a bit about our doctor. She attended MRSM all along for her secondary school, 3 years in MRSM Pasir Salak and 2 years in MRSM Taiping. So she was active with the debate team of both MRSM actually, and she was also have been involved in competitions with sciences and maths based. So back in Taiping, she was actually entitled as the best student with the cumulative GPA of 4.0 all semesters. Listen that, students. Such an inspiring person, yeah. Okay, so obviously, no doubt, she excelled both her SPM and PMR with straight A's, 8 A's in PMR and also 10 A's in SPM. So a bit on her career, right after SPM, she did her A-levels in College Yayasan UEM under the scholarship of Yayasan Terengganu. And then she admit into the medical school, University of Bristol, England, UK. So she graduated with the Bachelor of Medicine and Bachelor of Surgery. Okay, right after her degree, she went into her training placement in the UK. I guess this is so-called the housemanship for the medicine students in Bangor Hospital, North Wales for 2 years. And then right away, she went into a core medical training, which is a program for the sub-medical students. So she did her core medical training also in Bangor Hospital, North Wales for 2017, 18, 19, for 2 years. And then she went to Morriston Hospital for specialty training year 3 and currently at Singleton Hospital for specialty training year 4. So yeah, that's a bit about our Dr. Aliya. I think without wasting any more time, I shall pass the slide to her. If anything is incorrect, please correct me.
Oh, no, thank you very much, Tasneem. Assalamualaikum and a very good evening to all of you. My name is Aliya, and I would like to thank our lovely moderator today, Tasneem, for a very lovely introduction about myself, but I'm afraid it's not as grand as what she described. I actually was at MRSN Taiping for my Form 4 and Form 5 years in 2006 and 2007. And MRSN Taiping actually holds a very special place to my heart. So I'll tell you a bit more about that. So today is about medicine as a career, and I hope all the participants of this short session probably, I'm more than happy to take any questions, suggestions as I go along, because we're just going to make it as informal session and make it more, interesting and as interactive as possible. So can just call me Aliya. At the moment, I'm a specialty registrar, like Tasneem mentioned, in endocrine and diabetes. I would say that's the best specialty in medicine, and also internal medicine. And I work in Singleton Hospital in Wales, National Health Service in United Kingdom. So these are my best friends from MRSM Taiping. So Ili and Selina, if you're watching this, I love you to bits, and you helped me through MRSM Taiping and medical school, and made me to who I am today. And this is a bit about my family. I'm from Kuala Terengganu, and my family has been my strong pillar of support throughout my career. Well, my schooling time and also my career. So I graduated from University of Bristol 5.5 years ago, in Bachelor of Medicine and Bachelor of Surgeries, and then I started my training in North Wales for the first 2 years. As you mentioned, is part of the foundation training here before I could do a core specialty training in medicine, and I obtained my MRCP UK London about 2 years ago. This is basically a series of exams that you have to do if you want to do a specialty in medicine. And that's my lovely mum back with me. That was 6 years ago. So I'm going to touch upon about my training in the UK. So I'm afraid I can't elaborate too much about the training system or the medical schools in Malaysia, but I have huge respects for all my friends, to those who study locally, because obviously every place you go will have the set of challenges that you have to go through. But for me, training in the UK has been a privilege, and to get into this place was, I think most of them, mostly because of my exposure that I get from MRS Taiping. I think that kind of opened my eyes that you know, I want to study abroad, because I've seen a lot of success from our former students at MRS Taiping. So obviously, as the pictures depicted, these are the pictures from pre-COVID era. So we observe the social distancing rule very strictly here. So this was historical pictures, if I must say. So I'm from Kuala Terengganu, and now I'm residing in Swansea, United Kingdom, and I've been working with National Health Service the past 5.5 years. I chose to work in the UK, in Wales especially, because of the specialty training that I want to do, mostly in the North Wales, and now in endocrinology and diabetes in South Wales. A little bit about my some achievements from in the past, and at the moment I'm pursuing my specialty training in diabetes endocrine. So I must say, as for medical career, it's quite new to me compared to my consultants and my seniors. But I started my foundation training 2 weeks after graduating from medical school in 2015. Obviously, you get selection of specialties that you need to do. I think there's the same principle in Malaysia as well, to give you a variety of experience in different specialties and to prep you to further training. So passing foundation training, I must say, it's one of the most difficult time in my life. And a lot of people do actually have breakdowns, nervous breakdowns, you know, in the first year of foundation training. It either make you or break you, but you know, we just have to persevere. And then passing foundation training, I got into core medical training by national application system in the United Kingdom. And I got to do core medical training in the specialties that I chose, and one of them are endocrinology and diabetes, because I know I would like to specialize in that. And then after completing my core medical training, I got into my specialist training year, and at the moment I'm actually 18 months past my specialist training now. So this is like a brief timeline how I get to where I am. So I am the ST4 or Specialist Trainee 4. As you can see, graduating from Bristol University in 2015, and I spent the first year in Foundation Year 1 or Housemanship in Malaysia. And then I got to an F2 where I decided I definitely want to do medicine. I don't want to do surgery, I don't want to do psychiatry, and I don't want to do ophthalmology and other fields of medicine. They're all interesting, but I think my heart and my mind are definitely in medicine. And then I went for national interviews and applied for core medical training. It's a national training program, and I got selected, and I get to do my CT1 and CT2. It really depends on how long you take to finish all the requirements, but I managed to finish that in good 24 months. Now you can do up to 3 to 4 years, and sometimes extend a bit more if you don't finish it. And you can try to attempt your membership exam here. So if you want to be a registrar or specialist registrar, you definitely have to have a membership with Royal College of Physicians. And I had my MRCP UK in when I was a CT2. And again, to get into specialty training in the UK is also a national training program. So you have to compete with, you know, nationwide. So candidates from all of the UK, in England, Wales, Northern Ireland, and Scotland. So and I'm quite lucky that I got selected to continue to be in Wales, because I love Wales so much. I'm not gonna hide it, but I'm quite lucky to get selected into Wales specialty training program. So and 18 months ago I started with ST3, and then only 6 months ago I moved into ST4 level, and this is what I'm at the moment. So I guess the goal is to get to the consultant appointments here. I think if you are a medic, you definitely want to be a consultant specialist, and you want to be the best in the field that you are doing, to know everything about it. And being a consultant physician means that you have a better handle of every condition in that specialty. So so ST4 to consultant post is not that far, but for me it's actually a huge learning curve. But I'm so excited and very inspired to get to that stage, inshallah, when the right time comes. But obviously every year you have to meet specific requirements to pass that training years to move on to the next level. So it's like a video game. So if you don't pass, game over, or you have to repeat, or you know, so there are certain things that you have to do to achieve all the mandatory requirements and to move on to the next level, and eventually that will be the goal. And obviously, if you get to that post, if you want to specialize in different in other subspecialties, is something that you can do following professorship. So why endocrinology and diabetes? I guess people have different aspirations to what they do in life. In my case, I think it really hit me close to home that I have my late uncle was a type 2 diabetic, and he suffered from complications from type 2 diabetes. He suffered from renal failure and sepsis that led to his death. And at the time I was my items at medical school, and really broke my heart that my uncle passed away before, you know, he could see that I graduating from medical school. And obviously diabetes is such a prevalent condition in Malaysia, and it leads to a lot of complications, such as, you know, diabetic foot ulcer, leading to, you know, limb amputations, and organ damage, such as, you know, heart failure, you know, strokes, nerve damage, and diabetic ulcers are one of the scary complications from diabetes. So I have huge interest in diabetology as a field, but in the UK, diabetes, they go hand in hand with endocrinology. So I think, to summarize, endocrinology is a study or a field of hormones and glands, and how this imbalance of this hormones and glandular system will cause problems. And diabetes is a problem when the pancreas, which is the organ in our body, fails to produce insulin, or where insulin resistance is a problem for people. So obviously there are genetic links to diabetes, but also nutrition and other environmental factors contribute to this. But I'm very interested in learning to implement primary preventions, as well as treating diabetes as a disease, and also endocrine diseases. So any problem with the glands, so and problem with the production of the glands, production of the hormones from these glands related to endocrinology and diabetes. I'm not going to dwell too much into that, because I think people will be bored. So I'm going to go straight by medicine is the best specialty in my heart. I feel people sometimes feel that the doctor is a superhero, which is a common misconception, and I want to reassure you that the doctors are actually not a superhero, but they're also human being. They work under a lot of stress and pressure, but still they persevere. So doctors or a medical career requires long hours, both while studying at medical school and also on the job. And it requires lifelong commitment, really, because you have to keep updating your knowledge and your skills from time to time. So you come home, you have to, continue engaging with seminars, practicing your skills and polish it from time to time, because you want to provide the best information to your patient and keep up to date with the new treatments and new developments in medicine. So it's a lifelong commitment. You have to be willing to continue to learn from people, from journals, and participate in things that can keep you up to date with the skills and knowledge. The shift pattern as a doctor can be very erratic, because it's certainly not an office job that you work from 9 to 5 and then at 5 o'clock you clock out and you go home. But eventually you get used to this. It becomes a norm to you, and tired is not tired anymore. 1 cup of coffee is probably 10 cups of coffee for normal people. So you just get used to that, and you build a certain threshold in yourself, and you keep pushing yourself to a healthy limit, not excessively. And I think I have to reiterate that the responsibility as a doctor is actually huge, a massive, a responsibility put upon your shoulder, because you're responsible for people's lives and death, probably, and also their loved ones and their family. So you make a lot of difference to people's life by treating them or making their lives better, and also people who are around them as well. So I think the outline of my talk today, I'm going to explain briefly how to pursue medicine, because I know most of our viewers are my junior friends or members of MRSM Taiping students who are taking SPM very soon, and I wish you all the best. It's one of the most important time in your life. You will remember it, you will live it, and hopefully it will be a memorable phase in your life. So what I'm going to go through is how to pursue medicine. So at the moment, SPM obviously is the foundation to get into the next stage. So after SPM, A-levels is something that you can choose. I got offered to do A-levels after my SPM. I think other programs that can be offered, including International Baccalaureate IB, such as in College Mara Banting and College Mara Seremban, and also other colleges in KL, KTJ, for example, and KTT. I'm really sorry. I think they stand for a very long names, but these briefly are the colleges that offer these courses. And also pre-med courses at the unis, and also STTM is also one of the options. Metric programs, ASASI and Diploma Science Kesihatan, or any courses apart from medicine. You can still pursue medicine after completing undergraduate studies. So if you want to do or pursue a medical career at your university or as your ASASI, you have to have at least chosen medicine, biomedical sciences, clinical sciences, pharmacology, any science subjects that would save you a year from the basic pre-med year or molecular medicine. So as long as you ace in this courses the first year, you could apply for medicine or ask for credit transfer into medicine. So I guess what I'm gonna talk about or touch on quite a lot is how I get to my position at this stage. I did A levels, so I can tell you in length about how to get into A levels programs, the requirements from A level subjects to get into specific universities. But for those who are planning to study in locally, the requirement may differ, so you have to check on this current requirements for universities. So for abroad programs, so overseas programs, if you choose A levels as your medium, then most unis would say they would require triple A's, but actually the qualifications that they require is actually differ after you've done your A levels. Some of them would accept with a good A for a very important subjects such as chemistry and biology, and they can be quite lenient with the other two subjects. But obviously, if you get good triple A's, then they will be more than happy to accept you to the unis. But the chemistry and biology are the fundamental subjects that you have to have. And physics sometimes is the best three combinations, but also sometimes people do take economics or accounting to get into medical school and still accept it. So they're quite lenient about that as long as you have the basic subjects that they require. So with A levels, obviously you can still do a medical degree in Malaysia. So Indonesia, Middle East, in Egypt and Jordan, India, Czech Republic, Russia, Ireland, and obviously United Kingdom. And I believe the universities in the States also accept A levels. However, obviously, if you want to come back and work in Malaysia, then you probably don't want to do MD in America because it's not recognized in Malaysia unless you specialize in a field. So talking about tuition fees and education fund, I must say medical school, at least you require 4 to 5 years of study. So 5 years at medical schools actually is very expensive, no matter where you study, whether it's locally or overseas. It is very costly, not just competitive. So good results would actually be a stepping stones to get a scholarship. I must say, I must reiterate that to everybody. If you have good results, you try to be an all-rounder, and inshallah, you try your very best. And Mara especially are very generous in sponsoring students to do medicine locally and also overseas. So that's why we love Mara so much, and thank you very much, Mara. And also JPA is another sponsors, and Yayasan Negeri as well. So I must say Yayasan Negeri are they are very generous in sponsoring you and also to do postgraduate studies. So if you develop a good relationship and rapport with this Yayasan Negeri Foundation, you probably can persuade them to kind of continue to sponsor you after you finish your undergrad studies. So yeah, so remember that. And also Bank Negara. So if you have good results and especially when you're MRS Taiping, every year, I'm not sure about the current situation, Cikgu Aisyah, but during my year, I think at least a bunch of students from my batch got selected to go to Bank Negara's interviews and basically, I think the counselor at my time really prepped us for Bank Negara interviews and what we should be expecting during the interviews. And this is basically a platform for all of you. You're at the right place where people will offer you sponsorship, and you just have to do well in your exam and obviously in the interviews as well, and be a good person as well. But yeah, so you're at the right place to get access to all of this at your current position. However, with the current climate, maybe the current policies is different in terms of sponsoring students to overseas, because if you do risk assessments, probably going abroad at this stage would be quite tricky with COVID pandemic. So maybe the sponsorship program would focus more or entirely to local undergraduate studies. So I think the relevance of best universities, some people, they look into the best universities off the chart, looking at the league table, but I must say I have a huge respect for my friends and doctors who actually qualified and trained in Malaysia. Obviously, if overseas give you different experience, and the flavor of training at different countries give you different perspectives, and you bring back different knowledge, different cultures, different training experience to Malaysia one day when you continue to to work and serve in Malaysia. But I must say, if I had I not been accepted to study at Bristol University in England, I would have chosen to study in Malaysia, and the undergrad programs in Malaysia just as good as universities at other places as well. So obviously, if you were given opportunities to study abroad and to learn something new from different people, different nations, do grab that opportunity with both hands. But studying undergrad in Malaysia is actually our universities are very good with very prestigious standards. So I'm just gonna briefly show the league table. If you look at the best universities in the world or in the UK, this is the top universities in the UK from 2021. So Bristol this year, usually Bristol remain in top 10, but it's gone to number 11 this year. But top 3 are usually Oxford and Cambridge. But yeah, so they offer a traditional medical program for undergrad studies. Yeah, so this league table, they change every year, and depending on the ranking and student satisfactions and their achievements as well. But if you're interested in universities in the UK or Ireland, I'm more than happy to give additional input after our session today. We can always keep in touch, touch base, and inshallah, I'm more than happy to give a bit of input about this. And this is the one in 2021 by Madison, and again, I don't feel it's very crucial for us to scrutinize which uni actually do better, but these universities, they offer slightly different programs. So in Madison, you can do either traditional program, integrated, or problem-based learning. In Malaysia, most of them are integrated learning, where you have your lectures, and then you have your placements in the hospital, where you kind of integrate all the knowledge, all the things that you learn from lecture-based information from the textbook to hands-on skills and seeing patients and correlate information clinically. But for example, Oxford and Cambridge, they have traditional system where you only learn from textbooks for 3 years, and then in your 4th year, they place you in a hospital where you kind of learn all the clinical knowledge at the time. So the integration is slightly different. You are more academic based at the start, and then you learn everything clinical at the end. So some people prefer that approach, and problem-based learning is another system that medical school can implement. So they all based around a topic or a subject, and they learn around that subject from the group, not from a specific curriculum, and they target at first. So it's slightly different from integrated and also traditional system, but also just a slightly different approach. Right, so now we get to career in medicine. I must say there are too many careers in medicine. There are different type of doctoring. there are rich doctors, not so rich doctors, clever doctors, normal doctors, and very clever doctors, I must say. So you can choose to be a generalist. You can train to be a specialist or therapist, or you can, train to be an advisor. And I think what if you want to choose to be a medic like me, so I learned and study medicine and apply medicine, and I learned the subspecialty of medicine and want to be an expert in my medical field. But once you pass the medical school phase, you can choose to be a medic, a surgeon, or other medical specialties. So obstetric and gynecology. But to get through this phase, obviously you have to do your foundation training, and foundation training is actually a doorway for you to learn about other specialties. It's a difficult phase when you start your career in medicine, in housemanship, but you get the flavor of other specialties, and from there you develop your interest and then decide which specialty you want to pursue. So I must say there are over hundreds, or probably more than that, field of medicines that you could do. Some people like talking therapy, and they can't, I've got very good friends of mine who like to talk even though she's a medic, and I think she should have chosen to be a psychiatrist. But your interests and your interest in specific fields would differ, and as you progress in your career, you know for sure that, oh, this is what you want to do. And obviously at some point in your career you can choose to change your path slightly if you decided to choose a different specialty. So it's not the end of the world. And I've met a lot of friends, seniors, consultants who work in emergency medicine, for example. So they work in accident and emergency, so emergency departments, and because of the pressure and the stress working, in emergency department, they eventually decided to move into family medicine, where the working time is actually more fixed from 9 to 5. So there are things that you can decide to do at some stage in your career if you want to have some changes and to suit your lifestyle a bit better when you have family. Right, so future for medicine is very promising. I must reassure you, inshallah. It's a very promising field. But however, the challenges are there. You have to be persevered. Perseverance is important, so you have to be persistent and endure all these challenges. I think every career actually poses their own challenges, but in medicine especially, because you deal with people, another human being, and you see hundreds of them every day, and it affects your, because of the long working hours. Obviously, it is quite challenging when sometimes you have to overcome your tiredness, sleep deprivation, and sometimes you have to put other people first before your own needs or before your family's needs. So it's sometimes people think probably not twice, maybe 10 or 20 times before they get into medicine. But you do have this constant thoughts in you when, for example, for Hari Raya, you can't get a day off because you have to work. You can't, change your shifts and things like that. But it's constantly a challenge for you, but it is all very worth it at the end. So real doctors are not as glamorous as people think. If you watch Grey's Anatomy, like I'm a big fan of Grey's Anatomy, I really like something very intriguing, like, interesting cases, like, Dr. House. He is very smart. He's very smart, a smug as well, but he's very rude. So that is not the quality of a doctor that you want, and you don't want to be treated by Dr. House, as clever as he is. But and also Scrubs, you see this glamorous job and how people in the society actually uphold their position. Actually, being a doctor day in and day out, there are a lot of stress around it, but also very rewarding a profession. So if you go into medicine for its glamour, I think you are mistaken, because as well, there could be some glamour side of it, but I can reassure you, most of the time with COVID, with PPE, you don't feel all that glamour at all. So you have to have the right intentions to get into medicine, because it's such a long road to go through. So I can go to the next slide. So doctors, real doctors, not as professional actors in Grey's Anatomy. So real doctors, doctors are always in demand, and medicine is actually future-proof professions, and hopefully, um, there's always constant demand in junior doctors and also in specialists, consultant specialists in Malaysia, and no matter how advanced the technology gets, you always require doctors. The robots cannot replace a doctor to make a diagnosis. So and it always evolves. So if you feel that you can get bored easily with the same thing, in medicine you don't get bored at all. There's always new things that will need your attention to, something that you need to learn and upgrade your skills, so you won't be in the same position, or you won't be stuck in the same place for your whole working career. So it's always something new that you learn. So I think that's why you have to be good at keeping up with the current knowledge, and also the skills, as well as with the technology. So the COVID-19 that started last year, obviously, as you know, doctors are one of the frontliners that help serve the public. So the role of medical professions have been amplified even more. We played very significant roles in treating, diagnosing any respiratory illness. We've seen before in MERS pandemic, and SARS, Ebola, all of the medical professions actually help treat those who are affected by this crisis. So you actually get to contribute a lot, to make the world a better place. So if you feel like, I definitely want to be a superhero, then this is probably the right calling for you. And if you decide to specialize, so that means you're happy to take exams, happy to to learn a bit more, upgrade your skills from time to time, you can get into a specialist position, or you can do a bit of portfolio career. So you can be a lecturer at the university, you can do clinical jobs at the hospital and do your own clinic, or probably do a bit of side income, or you can join a private practice as well. But it can be very financially rewarding, so money will come to that eventually. So obviously, when you start medicine, that's not one of the important things that you think of. And then I think I would like to reiterate the point as your career is actually an ibadah, and for everything that you do sincerely for the sake of Allah, you feel it's a very worthwhile, and all the effort, all the long working hours, and being sleep deprived, they all make it all worthwhile. So if you have the right intentions to help serve people, serve other Muslims, helping others, making other people's lives better, like you're treating your family, these are all counted as ibadah in Allah's eye. So it's very important that you have the right intentions and nawaitu when you get into medicine, or if you are choosing medicine as a career. Right, so people ask me a lot about the pay grades for doctors. I must say they can be quite lucrative at the end. if you become a specialist or consultant specialist, and the numbers just not multiply, but you know, they go up every year, especially in this current pandemic. But you have to be a very ethical doctors, keep your skills up to date, and you mustn't kill anyone, because you know, I think in Malaysia it's MMC, so Malaysian Medical Council will monitor your practice, making sure that you are at your best in practicing medicine. So these are the numbers in the UK, so they are all in pounds, so I guess the conversion rate will be 5.5 sorry, £1 is equivalent to 5.5 ringgit Malaysia, 5.5 ringgit Malaysia. But it applies to a lot of specialties, you know, across the world. In Malaysia, if you do join private practices, you get a lot more money, and also you get to choose your working hours as well. But obviously, this is not the first thing you look at, because as I said, the nawaitu must be to help people, and it's also an ibadah. So this is just financial side of it. So, oh, right, we've got a question from Tasnim, is it?
Yeah, sorry,
Yes.
sorry to interrupt, but for the previous slide, the year 1 and year 2, just to confirm, that's the compensation that you would get for the housemanship, right? So do you,
yes.
Okay.
Yeah, sorry, and that's also per annum, sorry. So that's not per, okay. So I mean, everybody will be a billionaire after they finish that, but that is per annum. Yeah, that's per annum. Okay.
All right.
And also I must say that we pay a lot of tax in the UK, so you know, I'm not that rich, so I must say, but it is a very rewarding financially, but you know, as long as you continue to practice and decided that you want to move up your training career, you get to a place that you can be quite comfortable with it.
So will it differ like by location, such as in town, or okay.
Yeah, so especially, for example, if you work in London, the banding will go up massively, because, for example, if you do medicine in London, you see a lot more trauma cases, for example, or shooting in London. So you constantly have to be, you know, working as what do you call that, on call duty. So the banding can go up from 40% to 80% very easily, and your salary could, you know, double or triple. So yeah, and also you can still do your side income as well. So you can do locuming, extra hours, or you can do private clinics. And I have a friend who works in dermatology, and he does a lot of fillers, like, you know, like cosmetic fillers, not like face implants and stuff like that, but you know, as part of dermatology training, and he actually gets paid a lot for that. So you know, so yeah, you can be very clever in terms of trying to get extra monies, as long as you don't do something that is out of, you know, your comfort area and what you're trained for. So
you see, Barton is teasing me that I got excited seeing the numbers.
I know, right? But that's per annum. But that's per annum, yeah. That's not monthly payment. Yeah.
Proceed. Thank you.
So I think you're most welcome. And then so every year in the last 6 years, the UK government has increased the medical school, at least 3 to 5 medical schools every year. So the number of medical schools in the UK has increased quite a lot in the last 5 years. The qualifications actually, they really depend on every year, and although the initial qualification would be, you know, 3 A's, but they do accept with a good A's from major subjects and probably a B or 2 B's as well. So yeah. So I think that was kind of a brief overview about how I get into medicine and about my journey studying in the UK. I'm more than happy for the viewers or the participants to send me questions, suggestions, idea, or you know, to give you know, some input regarding medical career in the UK, and feel free to email me. I do check my emails quite often, but you know, and sometimes there can be delays in my replies as well. So please do not get offended if that happens, because it happens a lot actually. So, and I'm more than happy to take any questions or anything specific that people are interested to know.
Yep. Okay. Talking about your specialty training, I realized that there's ST1, 2 up to ST5, right? So
Yeah.
how long actually does it take to complete each of the ST, and like overall, how long would it take to be a specialist?
It depends on
I think it's
the.
yeah.
Sorry, just
Oh, up
this
to
one, is it?
ST6.
Oh yeah. Yes.
This
So
one.
it really depends on your specialty. So so for example, if you want to do pediatrics in the UK, it will be until ST8. You don't have your core medical training. You start with ST1, and then you've got ST7 and ST8, and then you get to CCT, and then you get to consultant pediatrics. So pediatrics is a bit different. Obs and gynae is also a bit different. So you've got ST1 till ST7 in obs and gynae. Because obviously obs and gynae, you incorporate surgical skills into obstetrics and gynecology. So it's like a surgical skills as well, and surgical training as well also differ in years, but mostly will be ST6 till ST7. If you're interested in infectious disease, for example, so the infectious disease specialists, like those who manage the pandemic, the COVID pandemics, or people who deal with outbreaks of diseases, the training years, I think, is only about 5 years. You can either skip the core medical training, get straight to specialty training, but that should finish within 5 years. So different specialty, they have differing length of training years. But I must say there are people who actually have done dual or triple specialty training. In my case, I'm doing a dual specialty training, so I'm doing endocrine, diabetes, and general internal medicine. But yeah, but some people can spend more time in core medical training, for example, if they don't pass the exams. So in my case, I spend 1 year at each stage, and this is the recommended time. Obviously, if there, for example, special reasons and that you can't finish on time because of health problems, family problems, or you're starting family, or whether you just can't complete the exams, you can extend that. But obviously this is mostly the UK and Ireland training system.
I see. So is there like a limit for the timeline that you need to finish?
I think with core medical training, yeah, I think you have to finish within 4 years. But as long as you get the membership of Royal College Physician at the end of your core medical training, sometimes you finish core medical training without having the MRCP. And there are different specialties that still accept that. I guess because things are quite competitive, so if you don't have the prerequisite that they want, so to get into that national training program is a bit difficult in the UK. In Malaysia, you have to have like a master's degree for every specialty training. So it really depends on what you want to do.
Yeah. So yeah, about the specialty training in Malaysia, sorry, I'm not very aware of it, but do you think that there's any difference of the specialty training abroad and locally here in Malaysia?
Very much so. I have a friend of mine who's at the moment work in Klinik Kesihatan, and she's doing an excellent job as a frontliner in Putrajaya at the moment. But she wanted to do a primary care as her main specialty, so family medicine. So she's hoping to do her exam, the master's exam, at the end of this year. So the training is different, but I think it will be a combination of master's degrees as part of your specialty training. Here is it's a training on the job. So you do your exam. So I have to finish my exam at some point here. I think by this year I want to do my SCA exam. So I don't want to wait until the end of my ST5 because I'm quite bored. I'm looking for new challenges. So I'm hoping to do the exam at some point this year. It's a very expensive exam, so I have to be sure that I'm ready for it. But yeah, so you keep challenging yourself to do something new, and this is how you push your limits. And yeah, but yeah, so every stage would have exams, and then after that you can proceed, and obviously that can change, and the time that you spend at every stage can differ according to what you need. And if you're starting family, you probably want to spend more time in that year. You can, yeah. So in the UK, I think it's quite flexible once you get into national specialist training, but in Malaysia it may be slightly different. Yes.
Yeah. Okay, got it. Understood. All right, we have questions, so I'll read one by one. So the
Okay.
first question would be from Baim himself. What are the challenges for you during your study days and also when you work? Because you study in Bristol, so I think it's common for us, like when we go overseas, it's quite hard. Maybe it's quite hard to catch up the accent and all, especially when you're in Wales, when you entered your job and everything. So what are other challenges that you may face during that time?
Baim, that is a very good question, because I mean, obviously in American Taiping, people speak in English because people are encouraged to speak in English, so you become brave and confident. And then when I come to UK, they have their own jargons, their own accent, and you kind of like trying to catch up with them, and you want to fit in. So I guess you want to be you want them to understand you, and be comfortable with your language as well. So there are things that you learn, you learn to adapt to the jargons and the daily language more often. But people still can tell that I'm not from, obviously my English is not my mother tongue. I'm not an English native speaker. But people can tell, you're not from this country, aren't you? I was like, yeah, of course. I've got a Manglish accent, like Malaysian accent. I'm so proud of it. And yeah, so textbook English is very different from the English, the English speaking language. I guess that only what do you call it? Once you experience living with the people and you get to communicate with them and interact with them in English, in the way, the language, the common words that they use, you kind of adapt it to the jargons as well. So I guess so. So it will be quite it will be very interesting how, when I get back to Malaysia one day, and to speak in good, because I only speak Bahasa Terengganu, because that's what my parents and my family speak to each other. So we speak Bahasa Terengganu a lot, and also English. So to converse in Malay would means mixing up, or combining. Yeah, I know. So that's why I think I prefer to speak in English now, but also I can speak Terengganu very fluently. So I'm more than happy to take any question in Malay. But it's a learning process. Do not be afraid. Do not be shy, because that's how you learn. You got to learn. You get to be better at something. You just hentam je, and then you get better when you do that. So yeah. Okay.
And then when you go into your foundation year 1 and year 2, it will be the first 2 years of you working, right? So what are the other challenges that you might face during that time? First time?
Yeah, the challenges is not to quit. A lot, because because you feel when you study medicine at medical school, everything is textbook. But when you treat a human being, they don't present the same symptoms, and patients. Okay, I become quite passionate in this. Patients especially, they lie. They don't tell the truth. So you eventually develop the skills to dig this important or extract this information from them. So yeah, like Dr. House said, number one rule: do not trust your patient, because they're liars. So you just develop the subtle skills to get the right thing from them. Like, for example, you ask patients, have you been traveling recently? No. But they live with people who travel to South Africa, and then they got COVID with the new variant, and you blame them for not telling you the truth. But you learn to tweak your questions to get the answers that you want to know. So but foundation years are hard because you don't know. You don't know about the reality of working.
Because you're new.
Yeah, but once you get through that phase, you feel more confident. You try to be resourceful, and you learn more that, okay, actually it's quite intimidating, but you know, yeah, you know what to do from there. So I guess that's it. Yeah, the main
because
challenges.
I've heard sayings as well that doctors are also like they're doing trial and errors. So patients have to tell everything truthfully
That's
so that
right.
the
Yes.
doctors can diagnose the correct ones. Yeah.
Correct answer. To be honest, I must say, my grandma, my late grandma, my arwah nenek, as lovely as she is, she always had the impression that doctors should know everything. So I remember when I was a child, I went to see a specialist with her, and the doctor said, "Oh, apa khabar makcik? How are you today? What's wrong with you? How can I help you?" And my grandma would say something like, "You're the doctor. You should know what's wrong with me. Why do I need to tell you?" So you know, people's perception, they change. But I guess, you know, in this new era, people have more expectation on doctors as people that they can trust.
But
So
still, you need to know the symptoms, right?
yeah,
Understood.
yeah,
Yeah. Okay.
right.
We have a question. I think it's from the students. All right. Is there any social skills that you need to learn to become a doctor? Because me personally, I think most doctors that I know, they are very soft, just like you. So, is there any specific character or any social skills, to become a doctor?
Number one, you have to be patient.
Patient.
Okay. Yep. Because there'll be a lot of hurdles and challenges in your line of work. Number one. Number two, you have to like people. If you hate people, like Dr. Gregory House, it's very difficult to work with them. And also, you have to be a team member. You know, you have to work as a team. So working as a team means you work with nurses, you work with nurse practitioners, you work with other therapists, and you have to have good communication skills as well with the patients, the families, and other specialists as well, because you want to fit back to this, you know, patient, your boss, for example, and other specialists as well to coordinate the patient's care. So if you can't deliver that information effectively, or you can't develop a good relationship with the patient, or the patients hate you, well, you just have to be prepared with, you know, with you know, you could be sued in court for something that you said that they're not happy with, or the service that you give that are not up to standard. So I think you have to like people, you have to have a good social skill, and you have to be willing to communicate effectively with your colleagues, with other doctors, with your nurses, with other multidisciplinary team, and with the patient. And I think you have to have a good empathy as well, because if you sympathize, oh kesiannya, or she's got cancer, or kesiannya, she's got COVID, it can affect you emotionally as well. But if you empathize, you can put the position, your place in the position, you understand the difficulties that they go through, and that, you know, you will have more soft skills, and you'll be more willing to understand and help them. And when they feel better, you feel much better, you feel 10 times better than they feel, because it's that rewarding. So empathy is important, but you know, social skills is also important. It's not something that you develop in a year. It's a continuous process as well.
Okay. So I think like the communication skills and also being a team player is such general soft skills. But for a doctor, I think you must have patience, and also like you said, the empathy is very important.
Yeah, I mean, being clever is not one of it, because if you want to make a lot of money, yes, you have to be clever. Being a doctor, you have to be hardworking. So patient is one thing, but I think in any fields, if you're clever, that's, you know, that's one ticket to get into that, you know, to get into that career. But to do well, you have to be genuinely interested in helping people to learn more. So the interest and aspirations should be from there. Do we have more questions? I think Tasnim has muted herself.
Oh, sorry.
Oh yeah,
Where did I
okay.
stop? Okay, actually, we're already at 10 o'clock, but we still have more questions. So are you fine with that? Can we proceed?
I'm fine as long as people don't fall asleep and doze off. I'm okay. Sure. I don't want people to feel bored. Yes.
Okay, we have a question from a student, Arif Aiman. What is the difference between internal medicine and also pharmacy?
Okay. The difference are huge. Basically, in pharmacy you learn pharmacology, so you learn about the drug interaction, and obviously you work very closely with doctors. And I must say, you have to be very good in chemistry to do pharmacology. And I have a lot of friends who are pharmacists that work in the same place as I am, and I think they're very clever people as well. But the difference are they don't treat the patient. Well, they suggest the treatment for the patient, but they don't examine the patient. They don't have to console the patient, and they don't have to speak to the family. So I guess they're more like the drug experts, the experts of the medications. What do we give to you to make you better? So that's the pharmacist, what the pharmacists do. They study the medications, the side effects, the interactions,
So
and
more
they
research.
advise.
Okay.
It, they can do a more research work, but also they can work in the hospital, they can work at dispensary, in the pharmacy, or they can work in the hospital. Where I'm working at the moment, we have a team of pharmacists that work with us, and they would recommend, oh, actually, we'd rather not give this medication to this patient, but they don't specifically go and treat the
Prescribe.
patient like doctors do. Yes, yeah, they would recommend it to the doctors. Yeah.
All right. Okay. So like as endocrinologists, you are involved in hormone therapy treatments as well?
Yes.
Yep. Okay. And would you mind explaining about hormone therapy itself in general?
So it's a very broad topic. I'm not sure we have the time for that. So
Like a brief
yeah, so
explanation.
a brief explanation. So I'm
Mm-mm.
going to use one cancer example and one
Yeah.
reproduction
That'd be good.
example.
Yeah. Yeah.
So if somebody has got a tumor in the master gland, for example, you've got a major or a big gland in your brain, which is the pituitary gland. So this gland produces a lot of hormones, and if you have a tumor or adenoma growing in that gland, that affects the production of other hormones. So other hormones that you need, for example, cortisol or thyroid hormones will be deficient. And sometimes for these people who has got tumor growing in the gland, in the brain, you have to have surgery to remove it. And obviously I'm the specialist in endocrinology and I'm not the endocrinology surgeon. So those who are, surgeon or do surgery in endocrinology, they can take the tumor out. But for me is how I would advise the patient that you need to have specific surgery and we have to give you treatment for this. Sometimes you don't even have to have surgery. You can just have a treatment to shrink the hormones, the tumor growth, and then replace the hormones that you need. And this requires a lifelong treatment, for example. So a lot of dynamic tests that you have to organize and hormones that you have to give and replace because they don't have that adequate hormones in the body in order to maintain the hormonal balance. So that's the example of the growth or cancer. The second one is, for example, people have problems with conceiving. So reproduction, for example. I think, I'm not sure whether a lot of us are aware about, fertility can affect men and women. So men can be subfertile or infertile and women can be subfertile or infertile. The hormonal therapy that we can replace, like even estrogen, progesterone, GnRH, and testosterone is something that the doctors or the specialists can prescribe. So I think our role here may be slightly different in Malaysia because Gynae does a bit of this, but they usually, ask for our advice and consult us whether this is the right thing to do. So endocrinologists would tell them that, okay, this is the hormones that you need to enable you to have a good reproductive life. You hopefully will conceive within this amount of time. We're going to give you this specific hormonal therapy, and then we're going to monitor your blood test so that you don't have side effects from it. Yeah. So that's very brief explanation, but that's probably about 5% of what we do. We do more than that because it involves multiple systems. But that's briefly what we do. And I guess at the moment, because I'm doing dual specialty, including internal medicine, everybody becomes an expert in COVID medicine at the moment because you see COVID patient every day, and you have to know what is the best antiviral treatment for them, and dexamethasone and stuff like that. So so more medicine and also your specialty training is all hand in hand, I guess.
Do you have any sharings on your daily experience since the COVID started? So any like a very something like something very impactful case that happened
Okay.
since, yeah. Do you have
Since
any
COVID.
to share?
Since
Yeah,
COVID.
since COVID.
Yeah.
Is there any difference in the hospital and like?
Yeah, of course. Yeah, huge change in the way we practice. And when I was in Morrison last year, one of our colleagues actually died from COVID. It was quite early on. It was in May, I guess, and it was just before my birthday. And she's only 32 years old. Um, a lovely Filipino nurse. She died quite early. At the start of her COVID positive. She was taken to intensive care unit, um, and apparently they obviously she required mechanical ventilation at the time because her lungs failed, and she was hypoxic is the term we use when you have reduced oxygen level and therefore you develop problems from it, including hypoxic brain injury. So after 10 days in intensive care unit, they had to turn off a ventilator because there was no brain activities, and it was very sad for all of us because she worked very closely with this in acute medical unit, and since then, obviously, even prior to that, we did all the precautions with the PPEs
Yeah,
and stuff. But I think Malaysians are very lucky. You have a huge pile of PPE donated by a lot of
yeah,
sponsors, which
yeah.
we don't have here. And I must say, I'm very overwhelmed with the response by Malaysians,
Conditions.
NGOs, yeah, and
Yeah.
with the fundings that the government actually spent for the public during this crisis. So
That's
yeah,
true. I must
hats
agree with
off to
that.
Malaysia.
Yeah,
Mm,
we are quite good handling it.
yeah.
Okay. Yeah, there's two questions about this. Have
Mhm.
you ever faced racism during your study and such? Yeah.
Yes, of
Yes.
course.
Can you
Obviously,
share an experience? You have an experience in it?
I can. I hope it doesn't scare people to come to UK or go abroad. But obviously, I'm a practicing Muslim, and I'm very proud of wearing my scarf. Um, but there are people who probably don't feel comfortable talking to you, being examined by you, because obviously you are different religion and you're different skin color. I think people are quite civil where I worked before, where I studied in Bristol. But I do have people from a different religion, and I shall not name that religion, but they just like, yeah, they just very anti-Muslim, and all 9/11 incident kind of make people scared. Islamophobia is actually very real, but nothing physical has happened to me. People would say things like, oh, you're a Muslim, you don't know why, you just pray to God and things will get better. And I said, that's not true. Like, our religion teaches us to take initiatives, and then we pray, and then hopefully you get better. But most of the time, if you do the right thing the right way, then you will get better. But yeah, so racism is something that I have experienced. Not very often, really. And I think as you grow more confident, you learn how to filter those comments to you, and you gain respect from them, because in Islam, when you
I
help people,
see.
you'll be rewarded. You dapat banyak
Yep.
pahala. So you kind of
Yeah.
like, it doesn't matter. I can do this. And you always like being friendly and helpful. And this is what, Islam actually teaches us. You
Issues.
have to be, you have to be like Rasulullah, always positive. People didn't accept his teaching, but, you are always optimistic and keen to help where you can. So racism is a real thing. I do have friends who also afraid being criticized for wearing scarves, and I know people sometimes feel like, oh, actually, to be safe in the UK or in the European countries, I have to take off my hijabs. because of that, which I disagree. And I think you can, it's actually for your own protection. It's a symbol that you're practicing Muslim, but I guess, you know, you just have to find the right way to deal with that.
Yeah, basically we have to just hang with our pillars and also our principles. So over time we can also deal with it, right? Yep.
Inshallah, yes. Inshallah.
Yes. Okay. So sorry, back to the slide. I realized just now
Yep.
for the best universities for med school, we didn't have Australia. Was it? How about Australia? What would you comment on doing medicine in Australia? Because I know some locals that went to Australia for
medical school.
Yeah.
Yes. Sorry, did I not include Australia in any of my slides?
I don't think so.
Oh my gosh, I'm really sorry.
It's just a specific subspecialties.
No, I have nothing against Aussies. They're great. They have great universities, and I have friends who actually study in Australia. And I think it's just me doing the slides in a very short period of time. I have missed Australia as one of the important countries. Yeah, so Australia, all the universities, most of the universities in Australia are acknowledged in Malaysia. So so medical schools in Australia, they are recognized.
Also okay.
Yes, of course, yes.
All right.
It's also closer to Malaysia as well, so you know you get to go home every summer as well. So so definitely Australia is in the list. Yeah.
Okay.
That's my bad on my side.
I just need confirmation.
Yes. No. Australia is definitely one of the good universities. Yeah.
So we have a question. Okay, once you got your consultant certificate, will you come back and work here?
Yes.
Okay. That's a question.
Yes, I love Malaysian food, and I love my family. So inshallah, I definitely will come back, and I would love to serve our people, Muslims and all Malaysians, and it's just so nice to be able to speak Malay again with people. To be honest,
maybe.
I know. Yes, people would be very happy to listen to my Terengganu dialect. But it's real.
That you pass all your specialty training and got your consultant certificate so that you can be here faster.
Inshallah. Okay, thank you for your prayers.
One student said, you must know Ali Abdal. I just Googled, maybe he's some kind of a YouTuber or podcaster. Ali Abdal,
you know what? I watch a lot of YouTube videos and I forget most of the names. So maybe I must have, heard or watched something. Anything specific to them?
No, he just said that you must know Ali Abdal. That's all.
Okay, could be. Yes.
Maybe I too should have a look later.
Okay. All right. Let's search on that.
Okay. Yeah. So that's all for today. That's all the questions for today. So as you know that our students is going for their SPM because of I think it has been delayed for about, I'm not sure how many times, but they're going to have their SPM test. So any encouraging words or advice for them, please?
A lot actually. So exam is basically one of the tests in your life. Obviously test you academically, your perseverance, your preparations. But SPM is actually not the hardest thing in life. And some people do well in exams. So in academics on paper, do very, very well. But so they are textbook smart, to be honest. But there are people who actually learn a lot from their peers as well and learn from experience. So I guess in life to succeed, you have to be both. You have to be good in the academics. But obviously, if you do not do well in the exam, that's not the end of the world. There are a lot more that you can do after that, and you still can pursue any careers you want as long as you have the right niyat, the right aspirations, you do it for the right reasons, and you ask for Allah's help. So and obviously SPM is probably one of the memories of doing SPM will be one of the things that you will remember. after you pass that phase. But yeah, I remember studying with my friends, but obviously with COVID, obviously it's all remote learning now. But you know, the end is near, so you almost see the end of the tunnel now. The light at the end of the tunnel is actually real, and it's not far now. So all the best, give everything you've got, and inshallah Allah will help you, and may you get all the best results in the exams.
Ameen, inshallah. All right. So yeah, that's all for today. Thank you so much, Dr. Aliya, for your sharings. You are indeed a very inspiring senior, even to
definitely not. Yeah, I'm very grateful that I get to share this very little experience that I have with anybody, because sharing is also a knowledge, and I'm more than happy to do that. And obviously, in any way, if I could contribute, please let me know. I'm more than happy to help and share in the future, inshallah. And I pray all the best to all of you, and please stay safe. Observe the social distancing, and behave yourselves when you go out, and make sure that you look after yourself and people around you. Okay?
Yeah, sure. And yeah, we really pray that everything will be easy for you, so that you can be home and speak Terengganu again soon as possible.
Yes.
Yeah.
Thank you.
Okay. Lastly, maybe Dr. Aisyah want to say something. Doktor pula.
Tak apalah. Cikgu Aisyah. Ya.
Allah, Dr. Aisyah. Amin.
Amin. Doktor what? Counselor.
Dr. Amin. Okay. Apa ni? Sangat interesting dengar. Student dia hantar mesej kat cikgu sekarang ni. Inspire gila cikgu dengan Dr. Aliya.
Alhamdulillah.
So, Aliya, semoga Aliya dipermudahkan urusan kat sana. Apa
Thank
saja
you, Cikgu
yang
Aisyah.
Aliya nak capai, cikgu harap Aliya dapat capai. Cikgu doakan Aliya terus sukses di sana. Dan kalau Aliya nak balik Malaysia pun kita orang pun seronok juga kan nak dengar. Okay Aliya, apa saja Aliya buat, semoga dipermudahkan urusan. Terima kasih banyak Aliya.
Terima kasih Cikgu Aisyah.
Thank you so much. Sangat-sangat betul-betul padat dan memang menarik.
Harap tak ada yang tertidur during this session.
Tak ada. Semua orang ni, thank you.
Thank you. Thank you for listening.
Boleh unmute yourself.
Student kalau nak cakap apa-apa, student nak cakap apa-apa dengan Dr. Aliya ke?
Ada ke?
Kita boleh unmute-kan you?
Special for tonight.
Ada tak? Kalau ada, beritahu cikgu. Cikgu terus unmute.
Okay.
Thank you so much, Doctor.
Okay, Najia. Thank you so much, Doctor. Okay. Ada ke lagi nak cakap dengan Dr. Aliya?
Dr. Aliya tengah mute tu.
Oh, sorry. Oh yes, I think Najiha just now mentioned about her thanks, and thank you very much for listening, and all the best, Najiha, to all of you. Inshallah, my prayers are with all of you. It's very difficult to get to this stage. SPM is real, but we will get past it, and inshallah, all we will be rewarded. Inshallah, all the best.
Okay.
Alright.
So, okay lah.
Okay.
Kita boleh end session for students.
Okay. All the best. Take care semua. Assalamualaikum.
Waalaikumsalam. Thank you, Aliya. Thank you, Dr. Aliya.
Okay.
See you again. Thank you so much.
Inshallah. Take care, Cikgu. Inshallah. Thank you, Tasnim, and thank you, Baim. Take care.
Thank you, Aliya.
Aliya datang balik Malaysia, kalau datang Emirates Taiping
Inshallah, Cikgu. Sebab kerupuk leko from Terengganu.
Bawa kerupuk leko. Yeah.
Cikgu tak sabar dengar dia cakap bahasa Terengganu.
Cakap Ganu.
Pak Im, tolong jangan mencemarkan bahasa Terengganu. That's a disgrace, Pak Im.
Macam mana Tasnim kita stop live.
Alright.